I'm pleased to welcome to the stage Gina Livy, Dr. Gillian Mandich, Dr. Sandy Van, and Dr. Sean Wharton. Please join me.
Since this is about the lived experience, a room full of people here today who are struggling, they have their own lived experience. Some people are just beginning the journey, some people are on the other side, and some people are in the middle. And what do you want to say to them today? If there's a message you could get across about your experience, what would that be?
That any one of you could be sitting here and sharing your experience. 5 years ago, I wouldn't have been sitting here and sharing my experience, because what you heard from Sandra about the internalized shame, judgment, and hatred, the self-hatred and the lack of self-compassion stopped me from sharing my story. There's a number of you in this room that have empowered and enabled me to own and share my story.
Dr. Sandy Van, maybe we can start with you. First of all, sometimes it's hard to find a healthcare provider. There's more options available for people, but it comes down to people being advocates for themselves. And can you talk a little bit about maybe how someone can start their journey on the right foot rather than feeling frustrated with the system or frustrated or showing up with what they've done or haven't done or what's worked or what hasn't worked? What can we do right now today moving forward to work that system better?
Community support seems to be really important, which is something I know that your program offers really valuably, and Sandra Elia and Obesity Matters. A number of the patients I've encountered who have been referred to me were people who went to their GPs and advocated for that self-referral. And the thing about GPs is that there are so many excellent GPs who understand the biology that underpins the condition of obesity. And then there's some who haven't yet caught up yet when it comes to patient advocacy, the understanding of what is the underpinning of the condition that they're living with so that they can speak about it intelligently to the provider who's going to be making that referral, understanding that there's community available. Being at a community like Obesity Matters is helpful because they do have access to these experts to just have the vernacular, to have the confidence to be able to advocate for yourself to your GP or whoever needs to make that referral, and to know at the back of your mind that there might be some hesitation because a lot of bias still exists, but that's not your responsibility to control. The only thing that you can control is how you speak up for yourself.
To you, there's so many ups and downs, like Andrew just spoke about. It can be infuriating. It can leave you hopeful at the same time. There's a lot of exciting things coming down the pipeline in terms of research. There's more access and care through telehealth and whatnot, but it can really wear on you. And how do you keep that positive mindset? Or how do we start to understand that the mindset is a big player in this?
It is, right? Because often, especially when we talk about obesity, the first thing we talk about is size or body shapes and stuff, but not actually what's going on in our head. It's such a critical piece of it. Like even just what Andrew was saying now, where it's like how you feel is affecting how you are operating day to day, regardless of the number on a scale. With the conversations that are evolving and with the medications that are coming out, the piece of our sort of mental health, our image, our identity, or like those sort of pieces also have to come forward, because we can lose a ton of weight, but we're still the same person in our head if our mindset doesn't change, right? Having those conversations with people, we all have different journeys in life, but sometimes going through it with community, knowing that you're not alone, right, is one of the most powerful things. And that's why I think that Obesity Matters is such a key player in this, because it's creating community to have those conversations.
What makes you feel hopeful? What gets you excited about this conversation?
Well, I had the great privilege of being somebody who's seen it in the past decade, what has evolved, and it was a much different conversation before. So I'm very hopeful, because when I first started, people didn't understand the biological underpinnings of obesity or living with higher weight and some of the things that can happen when you're trying to lose weight and regain it. And so a lot of that was just chalked up to being the fault of the person. But now people are coming to me 10 years later and they're saying, no, I get that stuff. You don't have to explain to me why I'm having an issue with this. I just want you to tell me about how to change my mindset about it and how do I engage in healthier behavior. Of course, there's still a lot of work to do, but I think that the progress that we've made in a decade owing to organizations like OM and other ones, that has been really remarkable.
There's a lot of negative and downer things about this experience that we could talk about today. But before we go, I want to start with you, Sean. What makes you hopeful when it comes to obesity medicine and obesity care?
What makes me hopeful is more so that we're having the conversation about love, because as much academia as you have, as many of the other things that you can find, if you can't get to that component of knowing that somebody out there loves you, somebody cares about you, some of the things that you're doing are important, and that's a reminder to deal with that internalized bias. So much easier to manage. Your physician, sometimes your physician is not the easiest. Even have compassion with them. They may get there. You can help them to actually get there, because many of them want to get there. Those that don't want to get there, get them out. I'm tired of them. Just like someone who's racist and is KKK and wants to stay there. But other people don't want to stay there. They want to learn. They want to move on. So be compassionate with them also. Be compassionate with yourself. Compassion with who's out there, and remember that you're loved and that you're cared for.
You know what? I'm going to thank the panel for joining me today. If you have the opportunity, don't be shy about coming up and speaking to our incredible panel. I know they would love to spend some time with you. Thanks, everyone. Thanks, Amy.
Thank you.
Thank you.